Hannah Mehta? Did I say that right? I apologize.
Chairman Shortner, members of the committee, my name is Hannah Mehta. I'm from Flower Mound, Texas. I'm here today on behalf of my son, Aiden, and the organization Protect Texas Fragile Kids, representing families of more than 2,000 medically fragile children throughout the state of Texas, many of whom are constituents in your districts. Because many families are unable to make the trek to Austin, I'm here today along with other families on their behalf. But if they were here, they would tell you repeatedly that there is a massive problem with the managed care system. It is not an occasional one-off issue or a series of anomalies. There is a systemic problem. Today, Texas families are seeing their ability to provide a hospital level of care for their medically fragile child in the home jeopardized by cost containment measures, an inappropriate delivery model, and short-sighted cuts implemented by private insurance companies whose primary interest is their bottom line and not the child's well-being and stability. These insurance companies do not see the value in these fragile little lives. Rather, they are profiting at the expense of appropriate care for very sick kids. Make no mistake, under the Star Kids Managed Care Program, there has and continues to be a systematic denial of life-affirming care for our state's most fragile children. Lining the pockets of private insurance companies with our taxpayer dollars is not an effective investment for Texas and our most vulnerable, and it is not an effective strategy. Yes, managed care certainly has a place, but it is not with our most vulnerable population. Capitated rates provide insurance companies an incentive to deny services, and when critical services are denied, there are very real, far-reaching consequences. Just ask the parent who's had to sit in the ER to obtain refills for medication their child's been taking for years. Ask the mother who's been told by an MCO medical director, as an agent of the state of Texas, that her child is not worth the investment in therapy to help her learn to hold her head up because of her diagnosis and her associated long-term prognosis. Ask the parent who has had to repeatedly explain to a profit-focused insurance company why their endless cuts and violations of the TAC code place the child's life in jeopardy. Ask the father who, with tears in his eyes, has had to repeatedly justify why his daughter's life is worth the value of medically necessary nursing services ordered by her physicians to keep her alive, and chokes back tears as he says, "It feels as though we've gone back in time 100 years and are going back to the days when I've been told to take her out into the woods and leave her after birth." I ask you, Senators, does this place Texas at the forefront of upholding the sanctity and dignity of human life and protecting the most vulnerable among us? We've all heard that bad data equals bad decisions. Over the past year, we've repeatedly been told that HHSC cannot obtain even basic denial data or accurate complaints data, much less individual and consumer-based quality metrics. So what is driving these decisions that are being made with massive life-altering implications for a very vulnerable population? It certainly is not patient and parents' perspective, which should be where theory, ideas, and plans become reality. In fact, it has become abundantly clear that firsthand daily experience of those using the system every day has been predominantly ignored, disregarded, and scorned for the preferred assurances of HHSC and agents of the MCOs. Nobody is saying the fee-for-service system was perfect, but we've further broken that system and further reduced access to care by implementing a far more restrictive model with even less providers and even less network adequacy. Let there be no doubt. The state of Texas has taken our most vulnerable and fragile children and thrust them full force into this experiment for cost containment purposes. We've traded short-term cost containment for long-term consequences. In many cases, very harmful life and death consequences for this extremely vulnerable population. And while the legislature may have obtained budget certainty, it is on the backs of very sick Texas children. Thank you for your time.
Thank you. Amy Lightson.